Kelly Carter, and I live in Napa Valley, where my life is eating and drinking. And I'm sure it's all that wine that contributed to my adenoid cystic carcinoma, which is a type of cancer I was diagnosed with. It's a very rare cancer. It's only 4 in 1 million people a year who are affected by it. And I didn't have any symptoms. I went to a new primary care physician in February of 2022. And it was a concierge doctor. She was the best doctor in Napa, and she was very thorough in her exam. And she said, say ah. I said, ah. She said, what's that? How long has that thing been on the roof of your mouth? And I said, I don't know what you're talking about. I said, I get my teeth cleaned every 3 months. I just saw my dentist last month. He didn't say anything. The hygienist has never said anything. So she said, I'm going to send you to an ENT. And so I left with all my marching orders, your mammogram, thyroid, everybody wants to check my thyroid, pap smear, all that, everything. Everybody called, and ENT never called, but I didn't think anything about it because it just slipped my mind, which is so unlike me because I'm always on top of my health care, not that I ever have any issues. Anyway, it took 6 months later, and an ENT called from another hospital in Napa. So I went in to see her, and she asked the same questions. Do you have any pain, any bleeding, and is anything, like, no, everything, I don't even know what it looks like. Everything's normal to me. And so she said, we'll monitor it. And I said, okay. So I returned 3 months later. There were still no other symptoms. They did a CT, and that came back. Everything was fine. She said, I'll see you in another 3 months. I said, okay. So now February 2023, so I'm a year past the time when my primary care physician noticed something. And she said, it looks the same. She said, Kelly, this can go on for 10 years. Do you want to do a biopsy? I said, sure. So she did a biopsy, and the results came back that everything was okay. But it said, we're going to send the tissue to UCSF for further interpretation. So thank God that, because I didn't even know the hospital would ever do that. A lot of doctors might think that they're God and think, okay, they've got the final word. Everything looks good to them. So I'm so grateful to the hospital, Queen, for sending the tissue to UCSF, because a lot of people, because the cancer is so rare, they just didn't know what they were looking at. And so the ENT told me that I had cancer. She told me what type it is, and she told me I was going to see Dr. Ha, and she talked very highly about, she's like, I know him personally, he's a great doctor. He has some connection with Napa, his wife, or something like that. So I go to see Dr. Ha, I bring him a bottle of wine. Because I'm going to bribe him and make sure I get the best care. So I took a very nice bottle of wine. He said, why are you bringing me wine? I said, because I have a lot of wine, like 500 bottles or something. I said, I have a lot of wine, and I'm sure that wine caused my cancer, and I'm not drinking. And Dr. Ha's like, no. And we don't know what causes this. I'm like, okay, give me my wine back. No. But anyway, so I had surgery to remove part of my palate, jaw, and a molar. And he had recommended that I get an obturator instead of doing the flap surgery. So I have a hole in the back of my mouth that's about that big or so, kind of where the soft and hard palate meets. The cancer was a minor salivary gland. And so I wear an obturator, which is a dental appliance. I can pop it out and you can hear how I talk without it, but it helps me to enunciate, and it keeps food from having, nasal regurgitation, which basically is my food will come out of my nose and my mouth if I don't wear it. Well, I've learned how to eat without it. Dr. Young was amazed at radiation. She's like, how do you because I couldn't wear the obturator, my mouth changed. Anyway, I might get the flap surgery at some point. The obturator works fine. Sigmund Freud wore an obturator. So did President Grover Cleveland. He wore one when in office, and a few people know that. And so the obturator works fine. It has its, drawbacks, but some of it's easy. I don't know if I'll go through the invasive surgery. I'll be 63 in a few months, and so I don't know if I want to go through that surgery. We'll see. But I had 30 rounds of radiation with Dr. Yam, who I got to know when I lived in San Francisco, and lived with a guy who was diagnosed with squamous cell carcinoma inside of his nose. He ended up having his entire nose removed. So that was all good education for me because I was a caregiver. I knew the radiation mask. I knew nothing surprised me at all. And so I was able to do everything very well. The guy who I was dating, I mean, he was down to the size of my finger because I had to like make all these shakes and try to fatten him up. So I didn't lose any weight. I knew exactly what to do with my treatment. And I asked Dr. Yam when I had my first consultation with her, and she used to laugh at me when I was the girlfriend because she'd come in the room. She's like, "You're still here. You're a new girlfriend. Anybody else would be gone," you know. But all those trips, and you know, it's like I knew exactly what to do. But I also got acupuncture, which I think really helped me. I started acupuncture the same day I started radiation. Dr. Yam helped me find an acupuncturist, Osher Center. They were booked until they weren't going to be able to get me in for acupuncture until right after I finished radiation. And I said, no, I had done my research. I was a journalist for years, so I did a lot of research. And I said, no, I have to do it at the same time. And so I didn't lose the sense of taste. I didn't have, I had a little bit of dry mouth, but not that much. And I didn't have any nausea. I stayed at the Cause House. I don't know if anybody knows about the Cause House, which is a terrific resource that UCSF provides for people going through cancer treatment and organ transplants and things like that. It's over by Parnassus. And it's a wonderful facility. They have 27 rooms. And so I stayed there and drove home to Napa on the weekends. And so I thought during radiation, I thought after a while I wouldn't be able to drive home. But I did. I drove home. I never had nausea, so I was fine throughout radiation. I had some mouth sores near the end. But I'd go home and people would see me and I'm walking through the vineyards and I'm at restaurants ordering food and I ate all through radiation. I ate everything I wanted to eat. Sometimes I'd have to eat in private because I couldn't wear my obturator, but all the restaurants were great. So I'm like, I know you don't do takeout on the weekends, but I'm only home on the weekends. Can you make something for me? And so I handled everything very well. I had trismus right after radiation, and Dr. Ha hopped on it immediately. I got my aura stretch, and then was able to eat hamburgers and everything throughout radiation. But then after radiation, 2 months later, then I couldn't even open my mouth wide enough to get a grape inside. I love grapes. Not just in the wine, but I like to snack on grapes. And so I worked diligently with Kara, and I went from an aura stretch to Therabite, and then back to aura stretch. I got on the phone, and I did a video. I did a Zoom with a top guy at aura stretch, and then they sent me one that was like in beta mode or so. And so now I can open my mouth with 45 millimeters. I mean, and I don't stretch anymore. And so, but I had to work my butt off to be able to open my mouth again. And the only side effects, I did lose hearing for a while, but it got to a point where I was just getting fitted for my hearing aid. It was time for my appointment to get fitted, and my hearing came back. And they said, and so every so often it disappears or something, but it's like if you have hearing loss or something, don't give up. Sometimes as things come back, it's like you just don't know after radiation. My main thing is I have a lot of mucus, and I have this whole left side of my face is impacted. I've got mucus that's not going anywhere. And so I don't know what I'm going to do to get rid of that. So I go to the sinus doctor at UCSF. He wants to do a balloon sinuplasty. I'm against it because it puts me at risk for a necrosis. And so anyway, I go back and forth. I'm going to go to Stanford and go to their sinus doctor. I had asked Dr. Haas, I said, can you write me a referral, please? I was like scared to ask my sinus doctor because it's kind of like asking your husband, can you have an affair? You know, like cheat and doesn't stand for it. So, but it's like I know I need to get. I don't know if I need to get the mucus out. I don't know. I'll find out when I go and do that. But that's my journey, and the worst part is that I have possible lung mets. And so that's pretty common with ACC. It's like, it's very treatable, but it metastasizes to the lungs. And so I try not to think about it. I remember when I got my CT, I was here, and then I was going to SFO, jumping on a plane, going to the Caribbean. I'm 7 months out of radiation. I'm going party in St. Bart's. So meeting my girlfriends in St. Martin, and we're going to St. Bart's. By the time I land, then I have my results. And of course, I'm trying not to freak out because I'm not telling my girlfriends. I'm not going to spoil our vacation. And Dr. Haas sent me a message, and he's like, Kelly, go by, you look good, you feel good, you're in the Caribbean, focus on that. And so that's really what I focus on. So, and we'll deal with the lung mets, next CT. I mean, they're growing, so it's probably about a year out before I have to do something with them, and so we'll see. That's my journey.